Let's talk about the difference between a non-STEMI versus a STEMI. Let's look at these differences using a chart. STEMI stands for ST elevation myocardial infarction, where NSTEMI stands for non-ST elevation myocardial infarction. Now let's look at the blockage. STEMI is a complete blockage of one of the coronary arteries providing blood flow to the heart, where a non-STEMI is a partial blockage of one of the coronary arteries. NSTEMI think not a complete blockage. This is a partial block. Now let's look at some EKG changes. In a STEMI, we'll see ST segment elevated. Just like the name says, ST segment rises higher than normal. Where in a non-STEMI, we might see ST depression or T-wave inversion. But keep in mind, you won't always see these EKG changes in a non-STEMI. Now, how do we diagnose these things? We'll use a 12-lead EKG, an echocardiogram, troponins, a CT scan, and an MRI. If you need more pared down information like this in nursing school, you can find it in the Complete Nursing School Bundle. Happy studying, future nurses.